As patron, I'm delighted that the Infection Prevention Society is supporting WHO Hand Hygiene Day on the 5th of May 2016 with the launch of a torch relay and associated events across the UK. Hand hygiene is critical behavior for healthcare staff and the public in preventing infections. I'm convinced that this fun and innovative campaign will engage people in recognizing the importance of hand hygiene. Thank you to all the members of the IPS for your commitment and enthusiasm. I look forward to following the travels of the torch and being at the completion of the tour at Infection Prevention 2016 at Harrogate in September later this year. Clean care is safer care promotes better care and saves lives all over the world. Many lives, between 5 and 8 million every year, mostly through better hand hygiene. As we did last year, we invite you to perform hand sanitizing relays and to attempt to obtain a Guinness World Record, having as many health workers as possible rubbing their hands in a long chain of staff using the technique recommended by WHO. We also encourage all healthcare settings still not registered in the WHO Save Lives, Clean Your Hands campaign to join the more than 18,500 we did over the past several years. This year, we propose to follow the journey of a patient in surgery. Did you know that almost 315 million people undergo surgery every year? That's twice the number of babies born in the world. And this means that millions of people could be at risk if the right action is not taken at the right time. That is why this year WHO is focused on hand hygiene to support safe surgical care. Improving hand hygiene practices in all surgical services is critical throughout the continuum of care, from surgical wards to operating theaters and recovery rooms to outpatient surgical services. So the message is, practice hand hygiene for surgical patients from admission to discharge based on clear WHO recommendation. Let's picture the scene. A patient is admitted to a hospital or clinic for a surgical procedure. These hospitals or clinics might look different in different countries. Let's hear from my dear friend, Dr. Peter Ntumba, about hospitals in Kenya, where he is a surgeon.
It is time to arise, Africa, as we mark the WHO Hand Hygiene campaign this year in Africa and around the world. Think about how many lives we clinicians will save with the use of soap and water or alcohol hand rub in our clinical areas. Good hand hygiene saves money and saves lives. I have personally seen a combination of very affordable strategies, including hand hygiene, cut down on surgical site infections significantly, as well as the cost of care. These are critical areas, critical issues for my practice as a plastic surgeon in rural Kenya.
But whatever the setting, hand hygiene will help save lives and prevent harm in surgical patients who go through this journey. First, patients are at risk of being colonized with germs if health workers do not perform hand hygiene before touching them, what WHO calls moment 1 for hand hygiene. But for those undergoing surgery, the risk of harm can increase as when intravenous lines or urinary catheters are inserted even before an operation has started. At these times, WHO Moment 2 and Moment 3 for hand hygiene become most critical. When a patient then progresses through the operating theater, unfortunately, a number of factors interact, and surgical site infection could occur post-operatively. WHO reported that up to 31% of patients will get a surgical site infection. 1 in 3 are due to Staphylococcus aureus, more than 40% of which is MRSA, making surgical site infection prevention an integral part of the antimicrobial resistance agenda. Surgical site infection also increases lengths of hospital stay for patients, which is a burden on everyone. When staff clean their hands, the risk of infection is greatly reduced. Before a surgical procedure, surgical scrub with soap and water or alcohol-based hand rub should be performed, as every surgeon knows. Let's hear from my friend Patch Dellinger, professor of surgery, talking about the importance of surgical scrub.
Also, using alcohol chlorhexidine for hand cleaning before surgical procedures ensures minimal risk for the patient if the gloves fail, while also protecting the surgeon's hands from irritation. Hands without irritation harbor fewer germs.
After surgery, hand hygiene is still critical in preventing post-operative complications. For example, when a wound dressing is being removed, WHO Moment 2 and Moment 3 for hand hygiene are again called for. Through this journey, whatever the surgical procedure is, we want healthcare workers to see their hands. See their hands as life-saving instruments that provide vital care to surgical patients. But we also want healthcare workers to see their hands as potential vehicle of harm if not cleaned at the right times. We cannot see the germs that are on our hands, right? But the 5 moments exist to make sure patients are protected. I have just taken you on a patient journey, a journey that happens every day. I recently spoke to another of my friends and colleagues, surgeons, Professor Joe Solomkin from the University of Cincinnati College of Medicine. And here is what he said in support of hand hygiene all along the surgical patient's journey.
So Joe, thank you for getting ready to discuss these together. You and I have been preventing infections in surgery for so many years. Tell me, what is for you the most important for hand hygiene in surgery?
Well, I think there's several elements to it, and the best analogy or the way to understand it is as a journey. And from the moment you contact a patient, even outside the hospital, not transmitting important and resistant organisms is very important. In the operating room, not performing adequate hand hygiene is a major risk factor for post-operative surgical site infection. And then post-operatively, if you're not exercising good hand hygiene before and after you see the patient, you've greatly increased the risk of transmitting highly resistant organisms.
Thanks, Joe. I would love surgeons to listen to you, but I'm pretty sure they will.
Oh, very good. Thank you, Didier.
Thank you, Joe.
Every year, we learn from each other, whatever setting we work in. This year, infection prevention and control and surgical teams are working together more closely than ever to prevent patient harm, and for these, we thank you. And this year, even more health facilities have signed up to the WHO Save Lives, Clean Your Hands, 5th of May campaign. Over 18,500 facilities have already joined us. Join us now if you haven't already. Thank you for committing to safer patient care every year. We invite all of you to pledge for safe surgical hands by sending your photos and selfies made together with your colleagues from patient admission, anesthesiology, surgery, operating theater, recovery room, surgical wards, and including outpatient clinics, as well as all places where care is provided. The address to send your photos and selfies is indicated on the screen. Let's make sure everyone has safe surgical hands. Thank you very much.